Picture this. The journey ahead starts here together, and together we can build a brighter future. You are listening to Illuminating Hope, a podcast of Hope House. What if we stopped thinking about nonprofits as organizations that simply respond to problems and start recognizing them as partners in preventing those problems in the first place? Welcome to Illuminating Hope. I'm your host, Tina Johnson. August 17th is National Nonprofit Day, a day that recognizes the contributions nonprofits make to communities across the country. And there is certainly a lot to celebrate. Nonprofits feed people, they provide housing, they support survivors, they educate children, they respond during crisis, they connect people to resources, they advocate for policy change, they mobilize volunteers, they bring people together around issues that affect all of us. But today I want to have a slightly different conversation. I want to talk about prevention. Because when we talk about nonprofit impact, we often talk about what happened because an organization was there to respond. But what about what didn't happen because someone invested in prevention? What about the crisis that was avoided? The unhealthy relationship that was recognized earlier? The young person who learned what respect and healthy communication looked like before entering an abusive relationship? The family that received support before a crisis escalated? The community that changed a policy or practice that was creating barriers for people? Those outcomes can be much harder to see. And sometimes that's the challenge with prevention. When prevention works, we don't always get to see what we prevented. Nonprofits are a significant part of the infrastructure of our communities. According to reports by the National Council of Nonprofits, the nonprofit sector contributed approximately $1.4 trillion to the U.S. economy and employed 12.8 million workers in 2022, representing nearly 10% of the private sector employment. Because I think the impact of nonprofits is bigger than economic numbers, nonprofits often occupy a unique position in communities. They are close to the people experiencing the problem. They hear the stories. They see the gaps. They recognize patterns. And because of that proximity, nonprofits can sometimes identify problems before they become visible to a larger system. That is particularly important when we talk about prevention. Prevention asks us to look beyond the immediate crisis and ask a different question. Why is this happening in the first place? And then, what can we change so it happens less often in the future? That is a very different way of thinking. Let's shift gears just a little bit and talk about from response to prevention. So in the domestic violence field, we understand the importance of response. When someone is experiencing abuse, they need safety. They may need shelter. They may need advocacy, or they may need legal assistance, counseling, financial resources, transportation, housing, or help navigating systems. Those services are absolutely essential. But if our goal is to respond after violence occurs, we are always working downstream. Prevention asks us to move upstream. The Center for Disease Control and Prevention identifies prevention strategies that include teaching safe and healthy relationship skills, engaging influential adults and peers, creating protective environments, strengthening economic supports, and supporting survivors to reduce harm. Notice something important about that list. It doesn't say prevention belongs to one organization. It involves schools, families, healthcare, government, businesses, community organizations, educators, parents, peers, and individuals. The CDC specifically emphasizes that cooperation and leadership across multiple sectors are important to implementing effective intimate partner violence prevention strategies. That brings us to an important idea. Prevention is not a program. Prevention is a community strategy. One of the most important roles nonprofits can play is serving as a connector. A nonprofit may not be able to change an entire system by itself, but it can bring the right people to the table. Imagine a young person who is struggling. There may be a school involved, a parent or caregiver, a counselor, a healthcare provider, a community organization, a youth serving program, perhaps law enforcement or a faith community, maybe a local business. Each organization may see one piece of the picture, but what happens when those organizations begin talking to each other? That's where collaboration becomes powerful. Research on cross-sector communities initiatives have found that partnerships can increase organizational capacity, knowledge, collaboration, and alignment around systems change. And that matters because problems communities face rarely fit neatly into one organizational mission. Poverty doesn't belong to one organization. Violence doesn't belong to one organization. Mental health doesn't belong to one organization. Housing instability doesn't belong to one organization. Child well-being doesn't belong to one organization. And neither does prevention. Here's something else I think we need to talk about. Sometimes we measure nonprofit success by how much we did, how many people attended the workshop, how many people received services, how many volunteers showed up, how many referrals did we make, how many people did we reach. Those numbers do matter, but they don't tell the whole story. We also need to ask, what changed? Did people gain new knowledge? Did behavior change? Did relationships become healthier? Did organizations change their practices? Did policies change? Did communities become safer? Did people have greater access to resources? Did we reduce risk factors or strengthen protective factors? That is the difference between measuring activity and measuring impact. The CDC's prevention framework is built around evidence, information, strategies, and approaches designed to address risk and protective factors at individual, relationship, and community levels. That gives us a useful reminder. Doing something is not the same as changing something. The goal of prevention isn't simply to be busy. The goal is to create conditions where healthier outcomes become more possible. So what does systems change have to do with it? And this is where I think nonprofit leadership has to evolve. We have to be willing to ask uncomfortable questions. Is the problem really an individual problem? Or is there something about the system contributing to it? Is a person failing to access service? Or is the system difficult to navigate? Are families unwilling to ask for help? Or have we created systems that make asking for help difficult? Are young people lacking healthy relationship skills? Or are we waiting until they're teenagers to teach them? Are survivors not reaching out? Or are there barriers that make reaching out unsafe or difficult? Systems change means looking at the policies, practices, relationships, resources, and structures surrounding the problems, not simply asking individuals to change. The Urban Institute describes systems change as recurring long-term cross-sector approaches that address root causes and engage the people most affected by the issue. This is a significant shift. It moves us from how do we help this person to how do we create a community where fewer people experience this problem in the first place. We need both questions. We need a response. We need prevention. For me, this is where the work of community engagement is so important. Prevention can look like educating young people about healthy relationships. It can look like helping adults understand warning signs. It can look like teaching community and conflict resolution skills. It can look like engaging men and boys in prevention. It can look like creating workplaces where people know how to respond when someone needs help. It can look like strengthening partnerships between nonprofits, schools, law enforcement, healthcare providers, businesses, and government. It can look like advocating for policies that remove barriers. It can look like using data to understand where the gaps are. And sometimes it simply looks like starting a conversation, because conversations can change what people know. What people know can change what they recognize. What they recognize can change how they respond. And repeat changes in knowledge behavior, relationships, policies, and environments can contribute to broader community change. That's why education is prevention. That's why partnership is prevention. That's why advocacy is prevention. And that's why community engagement is prevention. So what should we invest in? So on National Nonprofit Day, I think we should ask a bigger question then. How can we support nonprofits? We should ask, what kind of communities are we trying to build? And what will it take to get there? If we want safer communities, we have to invest in prevention. If we want healthier relationships, we have to teach healthy relationships. If we want children to grow into adults who understand boundaries, respect, communication, and consent, we have to start teaching those skills early. If we want survivors to have choices, we have to invest in the systems and resources that make those choices possible. If we want nonprofits to create lasting change, we have to give them the capacity to do more than respond to today's crisis. We have to give them room to work on tomorrow's solutions. That means funding prevention. That means supporting staff. That means investing in data and evaluation. It means building partnerships. It means listening to communities. And it means understanding that some of the most important nonprofit outcomes may never become headlines, because the best outcome of prevention may be something that never happens. So here's my challenge for Nonprofit Day. If you work for a nonprofit, don't ask, what are we doing? Ask, what are we changing? If you're a funder, don't ask, how many people will this program serve? Ask, what conditions will this investment help change? If you're a business leader, don't ask, what organization should we sponsor? Ask, What community problems can we help address? If you're a policymaker, don't just ask, how much will this cost? Ask, what will it cost if we don't address it? If you're an individual listening to this, don't underestimate your role. You don't have to lead a nonprofit to contribute to prevention. You can learn, you can volunteer, you can mentor, you can have difficult conversations, you can support organizations doing the prevention work, you can advocate, you can share accurate information, you can model healthy relationships, you can speak up when something's not right. Prevention is built through thousands of individuals and organizational choices. So, in closing, National Nonprofit Day gives us a reason to celebrate the people who dedicate their careers, their time, and their resources to making communities stronger. But I hope we don't stop at the celebration. I hope we also think about the investment in people, partnerships, evidence, prevention, and communities, because nonprofits don't simply respond to the problem communities face. At their best, nonprofits help communities understand those problems, bring people together around solutions, challenges systems that aren't working, and create opportunities for something different. And that's why I believe prevention is everyone's business. It isn't the responsibility of one nonprofit, one leader, or one funder. It belongs to all of us. So as we recognize National Nonprofit Day, I want to leave you with one question. What are you willing to help prevent? Because sometimes the most powerful evidence of impact isn't what we can count. Sometimes it's the crisis that never happened, the relationship that became healthier, the child who learned a different way, the barrier that was removed, and the policy that changed, the person who found help before they reached a breaking point. That is the power of prevention. And that is the work we can build together. Thank you for listening to Illuminating Hope, a podcast of Hope House. Until next time, remember that creating safer, healthier communities isn't something we do for people. It's something we build with them.